It's time for our health news roundup, and today we're talking COVID, skincare, and bedtime tips for your tweens. Let's go ahead and bring in our favorite guy here, ABC News medical contributor and pediatrician at Stanford Children's Health, Dr. Alok Patel. Oh, well, you're voguing already. Okay, well, why not?
A little voguing.
Hey, so let's talk about this new variant of COVID. One of the symptoms is this razor blade throat. What's this all about?
Gio, this is referring to the Nimbus variant, likely named after a cloud and a nod to the strain name NB181, not a Harry Potter reference. And the World Health Organization has named this a variant under concern. There's no evidence yet that this COVID strain is causing more severe illness, but there is some evidence that it might be more contagious, more able to infect people. And this is coming at a time when we have decreased population immunity and a lot of people out there who did not get coverage from a booster last season. And one of the telltale symptoms we're hearing about, especially out of Europe, is this razor blade throat. As the name implies, people are reporting this excruciating throat pain from this variant. So what people need to know out there is that this is a setup for a potential summer surge, a spike in cases. We're waiting to see just how well these vaccines may work against it. There might be some reports about an upcoming updated booster with a new strain, but obviously that is in limbo right now with new federal funding and regulations. But what people need to know out there is that testing is still pretty reliable, and so is washing your hands, wearing a mask in crowded areas, and staying home if you're sick. Because as long as you let the virus continue to spread and mutate, that's what it's going to do.
Oh, gosh. Well, I hope we don't get this one. Okay, so let's talk about this new skin cancer warning for people of color. When it comes to melanoma, Black people are 3 times more likely to die within 5 years of diagnosis than white people. This is an incredible headline. Why is that?
No, that's right, Gio. And, dermatologists and scientists have been observing this trend for quite some time. And one of the reasons why Black individuals are more likely to die from melanoma is because it's diagnosed at a later stage. Black individuals are also more likely to have a thicker, more aggressive type of tumor. So if you combine that with barriers to access and care and a little bit more difficulty in recognizing these skin color changes, that's a setup for some potential issues. So it is important for everyone out there, the public and clinicians, to be a little bit more aware of how this may present in individuals with darker skin. And it's also another reason why we have to address these barriers to access and care, not just when it comes to skin cancer, but with all types of disparities within public health, because getting early access, getting screening, getting prevention is everything when it comes to long-term outcomes.
What are the best ways to protect yourself, really?
Now, I want people to remember this acronym. When it comes to melanoma, think about any spot on your body and think about A, B, C, D, E. A, is there asymmetry? B, is the border irregular? C, are there multiple colors in that spot? D, is the diameter greater than about a pencil eraser? And E, is it evolving? Is it changing? So it is important to do regular skin checks on your body, including places like your nails, your palms, and inside your mouth. And if you see anything abnormal, you want to talk to a healthcare professional. And also, important tip, sun. Staying out of the sun is one of your best ways to prevent skin cancer, and wearing sunscreen every single day, rain, sunshine, or clouds. It is on my shiny face every single day is one of the most important things we can do to prevent our risk, to reduce our risk, prevent skin cancer.
Yeah, 100%. All right. Thank you so much for that. So last topic here, tweens and bedtime. A new study published in Sleep Health found that kids who keep devices in their bedrooms, and by the way, this is not just kids. A lot of us do the same thing.
A lot of us.
People use it during the night. They tend to experience more sleep disturbances. We know it's hard to keep kids off phones. It's hard to keep us off phones. How can parents be realistic about this?
Off the top, Drew, I'm going to say one of the most important things for parents, for society to do is to be good role models. We often talk about screen time use in kids and teens, but look around all over society. You see adults glued to screens as well. At home, it's important to create barriers, create tech-free zones. Show your kids that you don't go to bed with your tablet or your phone. Also, that when there's downtime, you don't immediately hop on a screen. And encourage your kids to keep those screens, any devices, outside the bedroom, because as you mentioned, these can cause frequent nighttime awakenings from those notifications. Kids are likely to go and check those. That not only is going to decrease the length of sleep, it's going to cause frequent nocturnal awakenings, and it can decrease sleep quality because kids are looking at those screens and their brains are getting engaged, and that's not restful. Poor sleep has been linked to many adverse childhood outcomes, including mental health illnesses, poor academic performances, and increased risk of chronic illness. So this is a growing problem we all need to address. And guess what? It starts with us. us adults.
It does start with us. Thank you, my friend. And thank you for reminding us that if you don't have a doctor who vogues, well, are you even doing it right?
I'm just saying. I'm just saying.
Dr. Alok Patel, thank you, my friend. We appreciate you.
Thank you.